Assalamu alaikum, everyone. Um, I'm so thankful that you all are joining this very important webinar. My name is Raffia Qutab. I'm the chair of the Liaison Committee, APPNA. For last 10 months, working as a chair of the Liaison Committee, I was working hard on this projects like, APPNA become the member of the AMA for advocacy and policy making, and then helping in the research with the Manasa group, for the people under minorities to get like, clinical trials to have better therapeutic outcomes. But on September 23rd, 2025, I came across to a very painful, unfortunate incident, which induced me to, to bring this very important subject of IMG health that we need to address. Before I go to the details of what happened on 9/23/2025, 2025, this is my humble request that today's webinar is an educational, yes, but the mood and the emotions are totally different, as there is a huge loss behind it, a human life loss, which is heartbreaking, which makes you feeling heavy and create an inside grief and panic. So please be mindful, be respectful in your remarks. And let's say a Fatiha first for Dr. Mariam Shaukat, and then we will go from there. Ameen. So on September 23rd, 2025, it was a regular day for me in my clinic. I was seeing patients, and I saw this post that a young physician is in ICU and need funds for her treatment. Immediately, I called the number on the post because it seemed to be of utmost, urgence there, that time is the essence and we need to act fast. Her husband, Dr. Hamza, he picked up the phone. It was the most painful conversation of my life. He was desperate. He was crying for help to save the life of beloved wife. Then I talked to her mom also, the Sugra Bibi. Very simple people. They were so scared, very far away. They are very far from their daughter. They were helpless. And they were dealing with the nightmare of their life. They were so proud of her that she, cleared all her American exams and was due to be back on September 30th, 2025. I asked Dr. Hamza to send me a consent form that if he allows me to start a fundraise for her, to share her info with people if he feels comfortable. Because I think without his consent, I was not feeling comfortable to go ahead and talk about her and start getting the funds for her. He said he has no problem. He will send me the consent, and he sent a consent. So I also requested him to write down on the consent form of Dr. Fateh Shahzad's name, who initially posted this post. So he write down Dr. Fateh Shahzad's name on it. I received the consent, and then we were trying to find how to raise the funds for her. First, we were thinking about bringing like through the GoFund, but that was a more complex procedure, and how to transfer the funds and how to raise them very fast. We were reaching out to the organizations, and then we reached out to APPNA. APPNA was kind enough that they agreed that they will give us the platform to raise the money for her treatment. And I never had any doubt about our APPNA members or our communities that they will not be able to raise this much fund for her treatment. And yes, there you go. In ours, we have a huge amount of funds coming for her treatment. And that was something, at that point, we were feeling hopeful and confident that, there will be enough funds for her treatment at that time. Meanwhile, I was in touch with the family, trying to comfort them, letting them know that funds has started coming, and we hope that we will be getting the treatment what she needs. While doing this, we created a small WhatsApp group. And in that group, I see the name of Dr. Farooq Kidwai. And I did not know him, like, at that time. And but they were very, like continuous information of her condition, her care were coming through him. And that was very, very helpful. But unfortunately, the end, what we were expecting, it didn't happen like that. And Dr. Mariam Shaukat passed away. Um, when I went to her funeral from Massachusetts to New Jersey, that's where I met Dr. Kidwai first time. And it was really a nice meeting to Dr. Kidwai and his family. And, um, we are like, I feel like, she was not alone there. That's the whole, like, kind of, with all the support through him or reaching out us to her family, I think still we tried, to be there as human there to, to support her. So I will go to Dr. Kidwai and I will first introduce you with Dr. Kidwai. And there is I will give a little info about him. Okay. Dr. Farooq Kidwai, distinguished alumni of Dow Medical College, Karachi, class of 1988-89. He is a multifaceted professional with experience in various fields. He's a philanthropist, entrepreneur, and professor at a New Jersey college. Dr. Kidwai provides coaching and counseling services to youth, trains non-practicing physicians for the pharmaceutical industry, and has taught at Sunday Islamic School for 20 years, I'm sorry. He is a co-author of publications on general pathology, tumor classification, and surgical cases for fourth year and final year students. Dr. Kidwai also serves as the chair of the alternative career pathways for the Dow Graduate Association of North America. With a career spanning pharmaceutical companies since 1994, Dr. Kidwai currently holds the position of Medical Director of Clinical Research and Development in the Cardiorenal Metabolism Division. He enjoys playing golf and umpiring cricket in his leisure time. Here you go, Dr. Kidwai. I will reach out to you and I will ask you a few questions that, that first question is that, what was your thought process when you saw the post about Dr. Mariam, or how did you find out about her ordeal? How you approached to this very sensitive issue of a young female physician who needed extensive medical care with no medical expense resources. What things you were keeping in your mind as a human being, as a father, as a doctor, about her care, her privacy, and how to avoid rumors. What will be your message to all the students, physicians who are accepting these students in their program as observers? What things need to be addressed before taking them in their programs? So please enlighten us on that.
Assalamu alaikum. Thank you very much, Dr. Raffia. Uh, I mean, you brought a very big issue, and I must appreciate that you took this challenge by your own, and you put everything together. You chases us, and you highlight and you organize this meeting. I mean, it is a very important topic which you have done with the support of APPNA. But I must say, and I'm thankful to you invite me on this program. Thank you very much. And thank you very much for your kind words about me. So let's go where it starts. So as you said, on the 23rd of September, I was going for my Zohar prayer at office, and I work like 43 miles away from my home. So I do my, prayers in my office. So while I was walking through, I just saw a blink, and it was Dogana platform. And there was a post which was asking somebody knows lives in New Jersey and can help a female doctor in ICU. And I looked at it, and then I saw my friend, Dr. Suhail Khan, and he said he knows someone in New Jersey area, and he tried to reach us. But I immediately contacted that person. His name is Dr. Gulriaz, and I said, I'm there. So he sent me a PDF, uh, which has just two documents attached. It doesn't say anything about it, just the name of the patient, and you know, and what does it need. So I quickly finished my prayer, and I rush to the hospital. I left the office right away. I said, this person need my help, okay, because she is, as per the letter, that it seems that the hospital was asking the US consulate in Pakistan to grant an emergency visa to the husband. So that's a serious issue. So I took it personal and I immediately reached out to the hospital. I don't know nothing about this girl. So I tried to find out how to get information, because I have no information with me, and I don't know how to talk to people and who to talk to person. And the HIPAA regulations and ethical issues, and I'm not the relative or family friend, or I have no consent. So what should I do? So I reach out to the patient relationship, and I say, hey, listen, I got this message from one of the alumni, and I need to see this patient to find out. And they contacted the coordinator of this case, and then I knew that yes, she is there, and she's in ICU, but nothing else. Okay, so what I said, what should I do now? So I was just sitting there and thinking, what should I do? Uh, in the meantime, the girl who I met, and I'm really thankful to her. And see, Allah make things happen.
Exactly.
I was there. The patient relationship. The lady came out. She was a Muslim from Morocco, and she say, "Brother, you are here. Okay, oh no, yes, I heard about this girl, and who are you and all those things." And then she said, "Let me find out more information about this girl." And they did find. She did find, and she came back to me and she said, "Yes, he is here and under ICU." So I was just sitting there and I say, Allah help me, what I can do for her. So then she asked me, "Hey, have you seen this girl?" I said, "No." "Do you want to?" I'm like, "Of course." So she took me to the ICU and I went into the room, and then I was shocked. I was shocked. Such a tiny, little, beautiful girl, you know, on ventilator, on dialysis, and cerebral edema. It hurts me so much.
So
It
painful.
hurt me so much that I have told this story to my family, and whoever asked me, but it still hurts me, because it's feel me. I have my own kids, and I have seen these cases, but whoever you feel is your real close one, it's different story. I did not ask anything from the nurse, attending physician, ICU physician. I said, tell me what we can do for her. I don't want to listen what happened. I don't want to know how she comes here. I want to know what we can do for her. And she said that, you need to talk to her husband, and we need liver transplant. And I said, what we are doing for that? I mean, do you let her die? You know, it is unethical. You will do a killing. It is not possible. You should do something. I was fighting like just it's my own kid. And then I talked to husband. Husband was so desperate. He said, brother, luckily I found you in New Jersey and you saw my wife, and you can tell me what is going on. I just briefly told him that what is going on. And then he gave me a consent, and he said, yes, since you are physically there, I'm giving you the consent to, you can talk on my behalf. So, and I was trying to find out people within New Jersey who work on those hospitals. As you know, I'm not practicing now. I'm working for a pharmaceutical company. So I know connections. So I try to find out the people who used to work there or who can help me in ICU. Unfortunately, I did not get much help. They say, yes, we'll get it tomorrow. We'll get it tomorrow. So I was very desperate, very, very desperate. So in the morning, I call the same lady. I say, "Hey, listen, did you get any information in the patient relationship?" She said, "No, we have not heard anything back from anywhere." So, but people are so many people, colleagues and doctors are calling to the relation office, but they're just asking what is going on. So we do not know what to do. So I said, okay, I because I have something to do, I went to work, and then all of a sudden I receive a call from the husband. He said, Farooq bhai, they are not doing the liver transplant because they need money. I said, what? He said, yes. I immediately left the place and I went back to the hospital and I contacted that girl and I said, listen, take me to the ICU. We went to the ICU and I say, what's going on here? Why you are not treating this patient? Why you are not putting her on the list? And then they said, let me talk to the treating physician. And then for 2 hours, I was talking to the liver transplant surgeon, the dean of the transplant, the whole team of the ICU and anesthesiology and everything. And I said, what I can do, I cannot promise you, but we will do our best to save the life. This is our dear daughter. I don't want to lose her. Okay. Whatever I can do, I cannot promise, but whatever my community, my colleagues, our alumni will do, we will do our best. I was every day visiting her and I don't want to leave her bed. It was so dear to me. Honestly speaking, अगर अल्लाह ताला ना महरम और ना महरम का ना रखता और वो बच्ची लेटी हुई थी वहां पे, मेरा दिल चाह रहा था उसको मैं पकड़ के ना भेज चलूँ और उसको प्यार करूं, क्योंकि अगर उसके माँ बाप होते, मैं आई वॉज टेकिंग हर जैसे मैं उसका बाप हूँ। और मेरा मेरा बस नहीं चल रहा था, मैं क्या
Dr.
करूं।
Khattai, the thing is this, as I'm just interrupting, like, as you are saying, literally, whenever I call them, I talk to them, I felt like, that I really want to embrace them. I want to hug them. I want to take their pain away. So I totally understand what you are saying.
या और उसके बाद ना जो सर्जन था, हालांकि आपको पता है कि ये लीवर ट्रांसप्लांट सर्जन वगैरह आसानी से हाथ नहीं आते, या डीन वगैरह मुझे क्यों फ़ोन करेंगे, लेकिन वो लम्हा ब लम्हा मुझे खबरें दे रहे थे उस बच्ची के मुतालिक मेरे प्राइवेट फ़ोन के ऊपर। और उन्होंने मुझे सैटरडे के दिन हमारा एक फंड रेजिंग था, मुझे उसमें जाना था। तो मैं और बेगम, मेरी बेगम, हम दोनों वहाँ गए। तो रास्ते में मुझे कॉल आई कोऑर्डिनेटर की कि भाई वो लीवर का अरेंज हो गया है, आप आ जाएं। तो आज रात को 11 बजे तक कर देंगे। फिर मुझे सर्जन की फ़ोन आई, कहने लगा कि मोहम्मद, हम जा रहे हैं इसको 11 बजे ट्रांसप्लांट करने, तुमने उससे मिलना था, जाके देख लो उसको। तो मैंने कहा अभी तो टाइम है। उसने कहा नहीं, हम 9 बजे उसको अंदर ले जाएंगे और क्योंकि उसको प्रिपेयर करना होगा और 11 बजे हम ट्रांसप्लांट करेंगे। मैंने कहा, तो मैंने, it was 7:30. I told my wife, hey, listen, just try to call kids from the home so take you back home. I'm going rightly to this hospital. And I just drove so fast. I reached there in 30-35 minutes. And I get into the ICU. And as soon as I enter into the ICU, I said, hey, what's going on? What's going on? Because it was panic, everybody was like crying. And I said, what? And then I look at the monitors and I say, oh, patient is deteriorating. So they say we are trying to build her up. And, my hands were shaking. Literally, my hands were shaking and I don't know what to do. I mean, like, sometimes you have generalized anxiety kind of thingy. I felt that. And I
Yeah,
said, okay,
the panic.
yeah, what is going on? What is going on?
Mhm.
And then surgeon called me and he said, Muhammad, have you reached to the hospital? I say, yes, I'm there. So they said that I'm coming there in 10 minutes, stay there. And he came back to me and he went into the room and then he said, I'm sorry, we cannot do the liver transplant. I said, what? Are you crazy? Why you are not transplanting? She said, no, we don't want to waste the liver. I said, what do you mean by you don't want to waste the liver? She's all right. Everybody is looking for it. So, you know, unfortunately, you know, doctor says we cannot do anything. And then the worst part is I have seen my father dying in my hands, you know. But seeing this, then when they ask me that we need a witness to be there when we are removing ventilator and other all those medication, because she was on just being on medication that's supporting her heart. So I say, okay, I'm here. But as soon as I start looking at the monitor, I say, no, no, I cannot take it. You know, I'm strong, I'm, mashallah, healthy, but you cannot see because I have that much feeling for her, you know, as my own kid.
Plus, it's too much to plus it's too much to bear.
Yes. And I said, I'm going outside. Please let me go outside. And I stood outside and I cannot talk anything. But you know what? Allah is the greatest. You know, when the doctor said, let me talk to her husband, and I said, use my cell phone. And when I was talking to him, her husband, I was, talking in such a way that nothing happened. Nothing happened because I need to be strong to give him support, because if I am crying, what they will be thinking. So I was like a normal person. I was, really, I was thinking what I'm doing. I, on one hand, I'm so sad, and on the other hand, I'm so strong. But this is from Allah. For certain period of time, then I called my wife and I said, listen, because she worried about me. Maybe I was there at 11 o'clock. And then she said, and because I told her that I will be staying in the hospital until she finished her surgery. So Dr. Pradana says, Muhammad, it is a 8-9 hour surgery, the transplant, you cannot stay there. I said, no, I'll be staying there until unless she is in recovery room. No? But what we were doing, we have, you know, I did not ask how much money has been collected. I'm not part of that thing. My whole game was to save this girl. Allah save, give her health, transplant. And, but we were trying things to get her recovered, and she wanted to meet her creator.
That's
So
that's where that's where you feel like this is not between me now and her, it is between God and her.
between Allah, and then, I cannot recite Inna Lillah. I was so sad. I cannot say Inna Lillah. Still I can feel, those things, in my eyes, and I feel so sad, you know, so sad. I cannot say Inna Lillah. Seeing for 3-4 days on her bedside, 3-4 hours a day or 5 hours a day, and then, leaving her alone. Nobody is there to say goodbye, you know, and Allah make her and give her a place in Jannah. That's all I can say. And
Thank you, Dr. Kitwai. It was like, and when you were saying that you felt very strong when you were talking to her husband, and one side you were feeling weak, you know why? You put yourself together that these people who are so far away, they need something conveyed to them that they would not, lose faith. And you were giving them this news that you have to be strong, that you are saying it's the will of Allah. Everything was done, but this is the will of Allah,
yeah,
you know?
but I must say one thing which I learned myself too. In United States of America, everything is very cheap. You can get everything, except you cannot get health without the health insurance.
Exactly,
Okay, that
exactly.
is the most expensive thing in United States, and this exactly happened with her, because the doctor was saying that she is not U.S. citizen, she is not a green card holder, she is not a resident of this state, she has no medical insurance, she has no money, and she is here for visit visa. So state just tied our hands. We
There's no
cannot,
ownership.
yeah. So we cannot do anything because she is a foreigner, no money. So, whatever they are saying. So my message to
Please.
anyone, the international graduates who are coming, willing to come to America, please do come. Please, we need you. Come, but be prepared. And I'm sure that other my other panelists will put lights on that, what they need to do.
Sure. And you know what? The last thing I would really, really want you to put a light on that. And that was done very because in the beginning, it was very hard for me because I was reaching to the family and I was trying to keep it in a smaller group, because I will be the last person to make anything rumors about anything, like anything like, to create hype in there. So, but when the people were, oh, what happened to her? Da, 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 and I was feeling very offended because right now we don't have to go through what actually, whose fault and what happened, how you were able to, because then I felt very safe when we were in a small group. If you remember that in that WhatsApp group we were 6 people, and you were keeping it there and we were telling each other that be mindful, don't bring this out. So how you were able to manage that?
You know, very simple, take it, it's you.
Beautiful.
If you put yourself in that shoe, is empathy. If you are empathetic, you will not do it. You will not talk about yourself in the public. Whatever you have, you will keep it yourself until unless you need help and need some guidance or something. We believe, and Islam also tells us that don't talk about others. People are not seeing it and they are making judgments. People are not seeing anything and they are making comments. So have you seen any of my post where I'm talking about anything? No, I did not say anything because it's, for me, it's my personal thing. She is my personal. So why should I disclose my personal thing to everybody? To just
Exactly.
make guess, speculations, accusations, you know. So this is what that's why I did not disclose anything, even when the body is going, when what we are doing with the body, because
Oh, I remember that. Yeah.
people were talking about
Hmm?
they do this to the body, they do this. I was quiet, you know because I was seeing the mentality. Even we are so much professional, we are proud that we are the medical doctors, and we said, oh, we are the top tier of United States. We come into the first 5 people of United States. But we were talking, you know it's
Yeah.
unfortunate. I don't want to say anything else.
Very unfortunate. But you know what? We are proud of the people who were really kind of there and they donated, they opened their heart, they opened their purses, they opened their pocketbooks. We are really, really, really thankful to them. And thank you, Dr. Kadbai, once again, being there, like when I was there, literally when I was going to her funeral, that I just wanted to keep this gesture and why I was showing it to everyone, that this is something we don't want, that, the feeling that she was alone there, she was
Yeah,
so far away,
yeah, she gave us a lesson. She
Yes,
brought all of us together for
together.
one cause, for one daughter, for one human, and everybody contributed in any way. And
Yes,
that is something which is a lesson learned. And because of that, we are sitting here and talking about this. And we wanted to, I think this is the target that we need to give some guidance to the people who are willing to come to United States.
exactly, exactly. Thank you, Dr. Kitwai. Now we're going to move to our other guest speaker, Dr. Maqsood Ahmed. He's a graduate of Allama Iqbal Medical College. He is a philanthropist and humanitarian, Secretary General of the NRP, non-resident Pakistani board member of Kamalia University, and chairperson of HCF. It's a non-profit organization with a mission to eradicate substance abuse in underserved communities across Pakistan. He has some important suggestions for the international medical graduate about their health awareness because he's still actively participating in the Pakistani society, Pakistani students, and so he will enlighten us with his views and his suggestions about it.
Thank you very much for inviting me here to join this panel. And this is a very serious issue for me. I have the awareness of this issue. I will recommend whoever is coming to this country. And By this incidence, we all are now more aware of this, and we're trying to bring this issue and address the issue in a proper way. So to address this issue by understanding this, what happened to our daughter Mariam, and how we come together by her incidents. So I will suggest that this is a very complicated process. So we should start engaging our back home, the institutions, the university and colleges, and where we could start a process of career counseling, which lead to this pathway of different countries, and US is one of them. Because of this complicated journey and long journey, and having all the different other aspect of this. So that's my first point, that we should address through this institution and build a pathway and help as much we can, make it more smoother, more easier, and connect the resources with all these students who are mostly new to this country when they come, and uh, they have to pass this time very under very difficult situations, very difficult circumstances. So that's second thing I recommend the people that are coming here. They have to take the responsibility that they should be themselves trying to understand the process. And when we set up a counseling, career counseling, they should participate in those programs. And it has to be like a mandatory, because this bring a lot of stress on our communities in the overseas. So that's why I want to make sure that both sides are responsible and they are actively engaged in this whole process, understanding it. So the third thing is that we should all Pakistani over here, not only the physician, also other community members, which are very easily to connect through the masajid, because our community here in overseas has a very good role of community centers. And if the people can understand this community centers, so they can connect with them directly wherever they are. We most of places we have the mosque. So that's easy to get connected with all the resources, the people, and the other things. And the last one, I will say that we have many state which has free health insurance, which is the most valuable information. These young doctors who are coming to this country must know the information and must enroll in those programs. So they are covered here in the US, because this is the most expensive issue that we can come across. So that's the main thing I want to stress. So we will work on these issues, and as we do more webinars, we'll bring those issues again. Thank you very much.
Thank you, Dr. Muksood. This was very, very brilliantly, you pull out, that these are the things need to be addressed. I remember when I was talking to you, you are also saying that, all the, program directors, they should be aligned with this, that, when the students are coming and being accepted over here, that you have some suggestion about that too. Would you like to talk about that?
The not only the program director, anybody who's participating in this rotation programs, and it's a matter of education and awareness in how when they're coming, the students should connect with them, whoever is a physician accepting them, to make sure they have everything in place, and that's what they can play this major role. And if the student has questions, so they already can connect them with those resources. So by having awareness and education process more in place, I think that will resolve our issues if we do go through this process.
And then one thing also I remember that you mentioned that institutional level, that it could be like, in the fourth year or fifth year, curriculum, something like that, to, for the, info about, like, being prepared to going out, to USA or UK. So what you think, that you still think that would be also very important aspect to cover this IMG health issues?
Definitely, if actually this is a all education process, and connecting with the resources and having them explain those processes, and it's a matter of how much they are engaged. They're not showing any kind, if they're showing any kind of like reluctant behaviors, not getting information. For example, I'm not really happy with the participant, very limited, and this was a very big issues, and how we can see the seriousness of these issues for those people that we are putting this webinar together, how they are thinking about this. So they have not really shown that much participation that we were expecting.
This is
So
very
there's
important.
lack of communication, the lack of importance of the issues. And I just want to bring this issue, like, for example, I called two of those young physicians and told them the information, and unfortunately, they did not connect with them. So we have to work a lot on these issues. It is our perception. So it's our attitude and behavior toward these major problems. And I know that how much stressful our community was from this just one single incident. So we don't want to have this kind of environment. We're trying to help back home our young physicians. They also need to be more responsible, and they should be engaged in their career, the resources that we are putting together for them, and they should be coming as a volunteer. They should do volunteer work through this program, highlighting this whole issues among the students. So that's why I think the participation, having the responsible young physician, is part of their training. So they
Yes.
need to become responsible.
Yes, exactly. And I totally second you on that. And I'll support that. You know what, we were like, this is something like we are, as a volunteers, we are here. We saw this problem, we were very hurt, and we wanted to address it. Okay. And then we were reaching out through all the social media and everything. But you well said, that if there is no participation, still there was a tool available for them, but they decided, no, we are not interested, we don't want to know about it, then there is no way, there's no magic wand that you can fix this, there is none. So, but I am so thankful that you are here, and as you said, one thing is very important, coming to the states of the, where the health coverage is more kind of, I don't know that it is like, available free care for the visitors or something, but they should be coming to those states which are more friendly about it, who they are more flexible about it, because certain states I know that they don't. So next we're gonna go to our panelist, Dr. Heather Alam. He's a graduate of the Liaquat Medical College. He's a gastroenterologist, and he's in upstate New York, a very active member of the Liaison Committee. And we are working together to put in place a very important tool which will help IMG tremendously. That's what we are hoping. So, Dr. Heather, just put some light on it.
Thank you very much for inviting me to this discussion. I think I want to acknowledge you, Raffia, because there is a difference between creating and thinking about something and coming with brilliant idea to making it reality. Everybody gets great ideas, but to getting to next level, and I know you work hard in this issue too, raising funds and communicating with the family. And Dr. Kadwai, I've listened to you. This is the second time I'm listening to you. You are such a great human being. I feel that, just like it says in Quran, if you save one life, you saved the humanity. I think you were rarely there to save a life. It was Allah's wish, and I just, you really have to accept it. I am a great fan of Dr. Maksud. He's humanitarian. He does a lot of work in psychiatry and all those in Pakistan. So we are lucky that we have a leadership here who is such a great leadership and caring. I'll go directly to what I'm thinking. I thought about many ways how we can help these students. And I feel, and this is exactly what I see in my practice. I have big practice and I do part is internal medicine too. And there's a community who will never adhere to guidelines of diabetes. They will never take care of themselves. And over the years, I've learned that it's not that they don't care about themselves, it's about how we educate them. If they get the good education, so we had a Spanish translator, we sat with them, we talked to them, and you can see a shift. So a culture of Pakistan is different than the culture here, how we take things seriously, how we are educated, how our kids are educated. And so that's I think there's a lot of work need to be done. But the idea which I was thinking was that, and I think we discussed and we are in very advanced stages of that, is to create a hotline. I've seen in my practice these societal hotlines, these crisis hotlines, even 911, they work great. They're wonderful tools. And if there's a hotline which is established by our group or whatever does that and can educate a physician who is in need, a student who is in need. So all he has or she has to do is pick up the line, call, and get the resources or information. It's not that they're going to be there within a minute to help them with financial, but they can guide them. Okay, so you are having this problem. We have physician that community, or we have some kind of information. This is the library, or this is where you stay. All these kind of things are very foreign to the people who are coming here. And the weather, obviously, somebody's going to talk about. But these things are, if we can just give them, if this patient or this person, I'm sorry, had some knowledge or some information before, maybe, I don't know, maybe we could have done something different. So I think these things, when we start and we talk about it, these are good ideas, but again, it's a leadership which takes them to the next level. And it's not going to be easy. These things are, we're starting and we're learning, like there's not much participant here, but these things take time. People need, and slowly when you start building them up, when you start educating people, then the people will see value to it, and then it will become common knowledge. So I salute all of you for doing such a great job. I am really sorry about this loss, and I pray for her too. But I think Dr. Kadwai, you did a good job, and you should be proud of it. Thank you very much.
Thank you, Dr. Heather. It was, put it well together. And this is a great idea, for the hotline. And I know there's intricacy, there's a complexity of putting things, together and then bringing it to in a working kind of, tool. And it is not that easy. But I think even remember that when we talked a few days ago, that as a liaison committee we can put some suggestions there that we can put it on the website of APPNA, and how it's gonna be, maybe using an answering service, maybe using an 800 number. Like there are so many ways, but side by side, it is also, as we are all noticing, that how much these student or IMGs are serious about it. Like if suppose they are coming with this mindset that when it happened and then we will take care of it, that is not sane. It is not sane at all, and this is how mostly in Pakistan, in societal, Pakistani, society, this is how jab dekh padegi to dekhenge, तो वो हमें change करना है, and it is a very deep rooted issue. It is not very simple to just resolve, So, but I really, this is a very important tool if we are able to put it in place, a hotline to help the IMG. It takes a lot of, it's going to be a lot of kind of, fine lines in there that how we're going to do it. and it takes time. But I think that is a great idea, Dr. Heather, and you are dealing with the IMGs. They come to your practice. Am I right?
Yes, they do. I think you're right. I think that mindset is जब होगा तो देख लेंगे सब
Yeah,
चलता है, that's
yeah,
a mindset. But I
yeah.
think as Dr. Maksud was saying, if we educate through the organization or the institution and also have, like we mentioned before, a first account of a person who has suffered this and tell people this, look, this can happen, then maybe even if we can change 2%, 3%, we have done the job. We look for major improvement, but sometimes it takes maybe 5% to change. And so our job is to keep working, keep creating these ideas, and then it's Allah's, Allah will grant us the success. So success is in Allah's hand, not in our hand.
बिल्कुल
Yeah.
बिल्कुल और उसमें ये है द मैसेज इज दिस आल्सो दिस इज दैट दैट देखो अब कितनी आपको डिस्करेज भी करेगा कोई कोई आपको इनकरेज भी करेगा लेकिन उसमें हर्डल्स होंगी बट वी नो दैट दिस इज अ सीरियस इशू we are seeing it as parents, as doctors, as human, and it's the whole like kind of training and continuously kind of like I'm a very private person. I don't put, but I becoming like kind of insanely like on the social media in that way, that why I put these things, that just to put an example there for people that this is what is happening, this needs to be done, this needs to be taken care of. Suppose like you put this post there and hey, you know what, we reached out to the family, or we are, all these physicians are together doing this, even though even 3 or 5% people, they are noticing it, but at least it's a big mass, 3-5% out of billions of people or millions of people, it still makes a
It's
difference,
a success. It's a
it's
success.
it's a success,
Yeah.
So, but thank you, Dr. Heather, and it's always pleasure talking to you. And thank you for helping us in liaison committee. Also, you're
My pleasure. You do all the work. We just sit there.
I know you're such a pivotal kind of member in there, So,
Thank you. I
and
appreciate
thank
it.
you for all the help and understanding and giving us the time.
No problem. Thank you.
Thank you. And now it's like now it's go through a journey or an evolutionary path of different panelists who came to USA in different time periods. So we're gonna start from Dr. Amna Qureshi. She's a graduate of King Edward Medical College. She's a hematopathologist, a very active member of liaison committee, very, very, helpful, always there, and she will share her journey more than or equal to 10 years ago coming to USA as an IMG, and how much she was prepared at that time and what was her challenges. Okay, Dr. Amna.
Assalamu alaikum. Thank you so much, Rafia, for this nice introduction. And thank you so much for doing this. This is a very serious matter. And thank you for putting up this webinar to brainstorm some ideas from, from all of, from everybody, basically, who can just pitch in and give us their views. And before I say anything, like your efforts in that incident, Mariam Beti's incident is matchless. Same goes for Dr. Kidwai. And, you guys are like inspiration for us. Like, and if we do even half of what you guys are doing, I think we have lived up to a challenge, which still I feel that it is unmatched. But mashallah, like whatever you guys have done in that difficult times for the family, for all of us, is unmatched.
Thank
Coming to my journey, I will not take a lot of time. We are already running late, but I will just say that I came to US in 2006, and at that time there was no WhatsApp. My mindset was that I need to be prepared, and because I'm going to a country and I had no family here, I was a single girl without any family. was a final year medical student. So I started by talking to my seniors, and then I got electives in Yale and Vermont. Um, for the medical students to do electives, it has to be before your graduation. Otherwise, it's not, considered as an elective. So that was the only time for me. But then, I never went to US before. That was my first time. And I was told it is going to be very cold and snowing. So then somebody said, baraf padi hai, tumhari jaisi hogi. But then, I discussed this with my parents, my dad, and he started making phone calls. And when I asked the question, kitni thand hogi, jaise Mari mein hota hai, वैसे ही आना होगा ना? So they were like, "ये नहीं भाई, you are coming to Vermont in January and February, जहाँ snowstorm होगा." So they gave me an idea. Some very nice people in my life, they gave me an idea कि भाई, come with at least layering. ठीक है, come with gloves, come with hat, scarf, proper snowshoes. Proper snowshoes, they are not available in Pakistan, but at least I was like, I knew, I was mentally prepared. मेरे लिए वहाँ शौक नहीं था जब मुझे वहाँ, negative Fahrenheit में, not even, I mean, it's very, it is below Celsius. So Fahrenheit तो फिर आपको पता है कि बहुत ही नीचे Celsius consider होता है. So, but I was mentally prepared, number one, and before coming, I made sure that where I'm living is a safe place. It's not about being a girl or a boy. It is about your safety, how far it is from the hospital where I'll be working. Choti moti snacks I packed with myself in my bag just in case. What if I reach, in my hotel and everything is closed and I didn't even know where to go. So where to go for eat. These are some basic things, but you know what? Main difference I feel is it's your मैंने बातें ये नहीं सोची कि भाई वहां जाके देख लूंगी. I had things prepared in my backpack कि मुझे ये चीजें करनी. I didn't bring a lot of clothes, but I brought these basic necessities. I even brought silverware. I even brought, जो है प्लास्टिक प्लेट्स और पेपर प्लेट्स कि मैं कहाँ से, अगर नहीं हुआ कमरे में तो कहाँ से खाऊंगी, बिकॉज दैट वाज माय फर्स्ट टाइम एंड आई हैड नो फैमिली. सम पीपल आर फॉर्चुनेट, दे कैन गो टू देयर फैमिलीज प्लेस, वहाँ थोड़ा सा एक्लेमेटाइज होते हैं, बट नॉट एवरीबडी हैज दिस अपॉर्चुनिटी. सो बी माइंडफुल अबाउट दैट, किस किस मंथ में आप जा रहे हैं रोटेशन करने, किधर रुक रहे हैं आप. दीज आर वेरी इंपॉर्टेंट पॉइंट्स. द अदर इंपॉर्टेंट पॉइंट इज गेट अ नंबर फॉर द मॉस्क, लोकल अपना चैप्टर. ठीक है, और दे जाने से पहले आप अगर इफ यू आर गोइंग टू अ देसी पर्सन, और आई मीन इवन इफ यू आर गोइंग टू some acquaintance, and but you're not like very family, आपका family कोई touch नहीं है, it's just like an acquaintance. At least talk to your mentor. एक दफा, अगर आजकल तो Airbnb बहुत common है, but tell your mentor कि मैंने इधर लिया है, is it safe, is it not. तो थोड़ा सा आपको, you have to be proactive. आज की बात कल पे, कल की बात परसों पे नहीं छोड़नी है. It's basically your safety. Agar if you're feeling sick, do not wait. Tell your mentor. Or if you think कि पता नहीं मुझे यहाँ पे treatment मिलेगा कि नहीं, talk to somebody in the mosque, talk to somebody in the local chapter. अपने alumni के number रखें, अपने alumni के presidents के number रखें. ये चीजें बहुत काउंट करती हैं. और ऑब्वियसली डॉक्टर राफिया का तो नंबर जरूर रखें. तो आप तो लेकिन मतलब लॉन्ग स्टोरी शॉर्ट, यू हैव टू बी
Well said.
प्रिपेयर्ड.
Well said.
तो यू हैव टू बी वेरी वेल प्रिपेयर्ड कि ये पाकिस्तान, मतलब यू आर कमिंग टू अनदर कंट्री. पाकिस्तान के दूसरे सिटी में भी जा रहे हैं तो आपको सोचना चाहिए कि हम कैसे जाएंगे, बट दिस इज अनदर कंट्री, सो यू हैव टू बी वेरी केयरफुल. So I guess I'll stop here and let other people say something.
So, Amna, this was very, very, I think very, very helpful, like bringing that these are the resources. So, when you think that when you came over here, and now you are seeing that you are working, and you are acclimatized to, all those weathers, you have all this, kind of, information about like survival kind of, list of, this. So, do you sometime like have a chance, or some newcomer coming, or somebody asking you, hey, you know what, I will be coming as an observer or something, and what things I should be prepared for? Do you see that sometime?
All the time, all the time. So we do a lot of, like, I do when I do mock interviews, off site. अगर किसी ने पूछा है कि, you know basically I'm in St. Louis, so मुझसे, अगर if somebody is coming, I can tell them exactly तुम्हारा hospital का है, तुम उस area में रुक सकते हो. I can give them list of hotels where they can stay. Now these days they are trying to build a apna house here, so we'll see how it goes. But like, till that time, we can tell them exactly what are the safe areas, how far you will be from the hospital. And everybody in St. Louis, who does mentorship, they are very nice. They do pick and drop service, sometimes do the groceries. And it's my humble request from all the mentors to encourage your students. And if you can do a little for them, it's very helpful for them. So I guess, that's about it. We have to play our part as much as we can.
Sure. And
Yeah.
do you feel sometime that, the time when you arrived here, when you came over here, and now the time that challenges are different?
It is, but the thing is, when I was coming, I guess our mindset was we need to be prepared, because there were no WhatsApp groups at that time. Information was like word of mouth. Here now, you are just a call away, right? ये आपकी alumni के WhatsApp ग्रुप्स हैं, क्लास के WhatsApp ग्रुप्स हैं, जो एक दूसरे को गाइड करते रहते हैं. सीनियर्स जो हैं आराम से अप्रोचेबल है. अपना भी बहुत अब ओपन आर्म से एक्सेप्ट करता है आपको, अगर कोई प्रॉब्लम हो. तो आप वेबिनार कर रही हैं अवेयरनेस के लिए, ये सारी
That,
चीजें नहीं थी. ये सारी
no,
चीजें नहीं थी. तो दिस इज अ बिग चेंज. बट नाउ एज वी से के माइंडसेट थोड़ा सा डिफरेंट है, कि थोड़ी सीरियसनेस ज्यादा होनी चाहिए इन इश्यूज के ऊपर, जो स्टूडेंट्स के ऊपर डिपेंड करता है. बोर्ड,
Students,
या.
I have seen students, and not just from Pakistan, but also from India. I had different experience. They are so thankful because their job and their future depends on. They know this is very important. I think they are desperate. First of all, you can see in their talk and their eyes, they are really desperate and they want to be successful. Now, outwardly, they will just act like cool and not, but inside, if you talk to them long enough, they will tell you that they appreciate that, they are very thankful, and they are looking for a way how they can advance. So they look at you. If you give them some guidance, they really, and they will listen to you very deep, like you can see they are listening to you.
evaluate.
Now, whatever you tell them, they will listen to you and they will think in their mind, they will process it and say, well, this is something. There is a financial stress on the family too. Some of them comes with their parents have, spend a lot of money to bring them. They have sold things because they think this is important. So that stress is on them as well. Not every, most of Pakistani are middle class people. They are not really high end people. So it's very stressful for them. And they will try to see if could jugaad like that, that they can cut the cost. So they will try to do that. But I think overall, I have seen people very thankful.
Yeah. Next is our panelist is Dr. Sarah Hamayu, and she's an internal medicine hospitalist in Pennsylvania. And she started her journey 5 years ago, and she will share her preparedness as an IMG and the challenges she was facing when 5 years ago. So let's go to Dr. Sarah. So Sarah has to unmute herself.
Hi, Assalamualaikum.
Alaikum salam.
Thank you so much for having me, Dr. Qutab, on this great initiative that you took. Means a lot.
Thank you.
So, talking about my journey, basically, I would consider myself a little fortunate in the sense that I had some guidance, some seniors that I could talk to, and they guided me regarding how to proceed. And I was a little prepared in the sense that I knew, like how US is so huge and you have to kind of figure out your way through. So my observerships were in three different states, I would say. So in Pennsylvania, I had to book an Airbnb, which I did quite a while ago before going for my observership is like 2 months at least before, from what I can vaguely recall. Then I had one in Chicago. I contacted the APPNA Health, and they were kind enough to kind of facilitate me over there. Then the third one was a Cleveland clinic where I had a contact through whom, like, I talked to someone who was doing the residency in Cleveland clinic, and they were kind enough to let me stay with them. All of this was probably like a few months before my observerships, like, were set out. So that being said, I took ample time to figure out how I would be moving around, where I would be staying. Although there were some difficulties, obviously challenges, that I had to commute in the cold weather, just like
Yeah,
Amna said, which
yeah.
I wasn't prepared for. And then obviously health insurance, I did not have any idea. But coming here now, I realized that how important that is. And I used Google Maps to, manipulate my way or figure out my way around. So definitely now with internet in our, reach, and having our mobiles with AI, everything on our fingertips, I think we should use that, and it would probably help you to kind of, plan your trip or plan how you want to go about your observerships, what suits you. So I think definitely now we should make use of internet and AI, and use the tools that we have, and any guidance that we can get, or I'm always available to give guidance to our folks who are coming here. So I think that
Thank
would
you.
be my 2 cents, that plan ahead and use your tools that you have.
Great.
Thank you, Sarah. This was very helpful. So if you have a few more minutes, I know that you are on call. Thank you for doing this. Thank you for,
No worries. Thank you.
participating. So my quick question to you before you go, Sarah, is that how, you were planning, you were coming to United States. So how much time ahead you started planning all this?
So as I mentioned, I would say at least like a few months, 2 to 3 months, because let's say you plan on staying with someone, you need to give them ample time to figure out if they're okay keeping you. And in case they're not, you should have enough time on your own to figure out somewhere else that you would want to stay. So I think, like, if someone knows they're going for observership, you want to pursue this path, you should start planning ahead, and you would know that, okay, I have to go for observership, which would be, at least you're applying for observerships, so it gives you a few months that, that when you have to go. So use that time to kind of, figure out how you'll stay, and start working on it right away once you're accepted for observership, because they give you at least a 4 or 5 month time before, they kind of schedule you on for observership anywhere.
Cool. And Sarah, what were your expectations like when you are staying with someone, who is hosting you? What
Right.
was the expectations of you from them?
So, I mean, I would put it more like their expectations, because if someone comes to your place, you would expect them to be, grateful that you're keeping them, and be, just as little of a hindrance to their daily routine. So just, if you're staying with someone, try to, make your own commute system, instead of relying on them, I would say. And then my expectation would be that at least they're kind enough to, host me or let me stay at their place. That's pretty much what I would expect, to be honest. I would not expect a lot from someone, because everyone over here is pretty busy with their own lives. It's nice of them if they go like a few steps ahead, prepare meals for you or help you with your daily stuff. But again, that should not be an expectation, I would say. The only expectation would be like they're gracious enough or kind enough to make you feel welcomed. That
Yes,
would
exactly, exactly. And you know what? That is the part of like growing up, like, being independent and being showing that, what, the ownership that this is my responsibility, and if somebody's doing this out of courtesy, we should value it and we should not be like kind of trying to expecting more from them.
right.
Yes. Sarah, it was really, really very helpful. And is that something that you remember, that any incident that you felt like, hey, you know what? I wish I was prepared about it.
I mean, definitely, I think I would probably again say that I should have been prepared for the weather because I did not have shoes which were adequate or good for the weather, and like it they were kind of ruined with the cold, snow, or the rain, etc. So I had to figure that stuff out. But again, I think weather, and now thinking about it, health insurance, I should have kind of looked into it. But again, you learn with time, and now that
Yes.
we have an incident, I think we should all learn from it.
Sure. And then the last thing is this, that at any point, like, when you were doing your observership and you were sick or ill or for something and you have to take time off, how much comfortable you were asking your supervisor that I need time off or I'm sick?
So I think uh, as an IMG, you want to show them that you are interested, you're, excited about everything. So you kind of put your health at the back burner. But I personally think that if I were unable to go, I would just kind of, be upfront and apologize. So, but again, at that time, if I were to think back, I would not have said anything and just gone.
Oh, wow. So what you would suggest to the all the newcomers, that if they need help, medical help, they should not hesitate asking about it.
Definitely, because it does not kind of now being a part of this culture to an extent, I would say it does not kind of change your opinion in someone's eyes, or it actually makes you seem more confident and self assured. So, definitely, if there's an issue, you should talk about it or bring it up.
Sure, sure. And I think all the hospitals, they have the, diversity, offices and stuff, that if you
Mhm.
see anything, that you can always reach out to them too.
Definitely.
Yeah, yeah. Thank you, Sarah. That was really
No,
very, very helpful. And thanks for giving us the time.
no, thank you for having me for this great initiative that you took.
Thank you. Thank
Appreciate
you. Have a great day
you too.
and night,
Thanks.
actually now. Thank you, Sarah. Okay, and now we will go to our current IMG, Dr. Abdul Manan Babar. He's a graduate of Federal Medical College, Islamabad, Pakistan, and he's doing observership at Mass Eye and Air, Boston, Massachusetts. He will share his list of preparedness in regards to coming to USA as an IMG and his list of challenges. So, Abdul Manan, it goes to you now. Thank you for joining us.
Thank you so much. Assalamu alaikum. First of all, I would begin by sincerely thanking you, Dr. Qutab, for inviting me and arranging such an informative session for international medical graduates. It's a wonderful initiative that addresses real and practical challenges we often face when moving abroad, like in US. So
Thank you.
I would like to point out some basic points which are mostly overlooked by most of the IMGs, which I have observed, which I have seen, my fellows have overlooked, so they are not well conveyed to the others as well who are coming behind them. First of them is institutional counseling. I think institutional level counseling is very much important, as you were saying. There should be some sessions which should be arranged in institutions that people going to abroad should have following checklists. Secondly, I would like to mention the financial aspect. Before coming to the US, one must have sort out how they are going to pay their bills or pay in different situations. Like one before coming to the US, one must have international credit card, which is very important. I myself face this challenge. I have international card, but due to some reason that was not operating. So you must have some cash as well as a backup. And secondly, in your first, uh, whenever you come here, try to buy an eSIM. You should have eSIM. Then you should go to the banks where mostly in US, PNC is the bank which provide you the as on visitor visa, which provide you which give you easy access to open an account. You can open a student account, and that helps a lot. That helped me a lot to book my flights, to book Airbnb, to use Uber, to use public commutes. So this thing helped me a lot. So this should be kept in mind. Secondly, before coming, I would like to say, before coming to the US, one must know what challenges he or she can face. Everyone can face different challenges, but he or she can, using the AI, using the different Google Maps, and using the different things, one can make a checklist of things which he can face. One can make a list of problems he can face, every possible problem. Anything can happen here. Like for me, I have never expected that I may miss a flight. Even I have a 5 hour gap between the two flights. So you must know, if I miss a flight, what should I do? What can I do? Whom should I contact when I reach there? So all these things should be arranged. Third thing I would like to mention is the personal health. One must have an emergency contact list, emergency medical list. If a person has any disease or anything else, like taking any medication, he should make a list of all those things and arrange them in order, easy accessible. He or she should have almost every time whenever he go out, he should have that list. Anything happen here, uh, for me, there is no contact in US. When I came here, it was emotional trauma to me as well. To be honest, it was an emotional trauma to me as well. When I land here, I was expecting something different, but it was totally different. So one must have, it is always better to have knowledge beforehand before experiencing this. So it is a very wonderful session that we are giving knowledge to the patient, knowledge to the IMGs, my fellows. All you are very generous to arrange this session. All you have talked very well. I was listening. I was When I was listening to you guys, it was like, why this session has not happened earlier.
Thank you.
So, there are now there are many sources where you can contact, where you can check what should be arranged, what should be done. So at the end, I would like to, apart from all those things that you guys have mentioned, I mentioned to highlight all these things, that check your financial aspects, like how you navigate those things. Check whether you go, how you commute, how you gonna use commute there, how is your locality, and third is the personal emergency contactors. So these things should be known to each and every IMG who is coming to the America. These are the things I would mention. Uh, Although, in addition to all the things that you have mentioned. So thank you so much for allowing me to share my thoughts and my 2 cents. This is all I have to say for now.
Uh, Thank you, Manan. This is really, really was very helpful, and especially now when you are coming over here, this currently you are here, and you can see that how many tools are available and what things you can use, and you are telling very, very like truthfully that when you are there, you think about this differently, and when you are here, it is totally different. It's a cultural shock. It is like a you are homesick, you are so far away, you don't know, if you don't have a support system, then you feel like very lonely, isolated. So this is something, I think I would have a question from you in that way, that when you were coming to America, and
Yes,
did you think about the health insurance?
yes, I will be honest with you. I personally didn't think about it, because it was like in every IMG. If I ask, it was to the program, like I was doing rotation in Mass Eye and Air. It's an Harvard Medical Institute, and it is very well organized. They required health insurance. They required my all vaccination record. They required health insurance. They required my recommendation letter from my institute where I am resident in Pakistan. So they required full information of emergency contact lists. They provide me all these things, that you have to fill all these forms, you have to provide all these information to us before you get accepted to our program.
Okay. So you feel
That
like, some programs are more organized than others. Am I right?
Yes, I have seen that. Yes, I personally have felt that.
Okay.
Uh, so 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 that so that so so that's why I bought the health insurance. I got vaccinated. I made a list of vaccination. I have to fill those forms because I have seen that it was very well organized here, and they required each and everything, and they have check and balance. So they don't only require those things. They need a proof of all those things. Like they want these things to be, and then they those all those things I sent to them. They get signed by my preceptor that all these things are given. Now we are ready to accept that guy. Are you willing to accept that? Then Dr. Thomas Dolman, he is my preceptor, so he said, yeah, all these things are fine. Now he can join. So then I came to know about health insurance. Before that, I have that thing in my mind, but whenever I ask to my seniors or my fellows, they say it is just not a big deal. You should not require that. That's just an extra burden amount, uh, just an extra burden. So I was not. But after the incident, after going through all these things, I think it is very, very important to have an health insurance, like and and after that I was thinking it would be a very big issue to get an health insurance, but to be honest,
It's
it's
not.
very simple. Very simple.
Yes.
It's Yes, it's very simple. You can easily buy online. You can easily buy online, and there are different plans. And even after apart from that, I would it's already highlighted that in mosque you can always get a help. So you
You're
can also get help from there. So, but insurance should be one of the priority things that you should have before coming to the IMG. You must think about it and you must research on which insurance you should buy. So it is very important.
sure. And do you think, Manan, that uh, now you will be talking more about to your peers about this, that this is really very important?
Yeah, I am talking to three or four peoples, and I told them that these are the checklists, these are the things you should have, and I mentioned I before coming to here, I was not mentioning this thing. Whoever asked me which thing you should have, I am here from last 4 months, so there were which things you should arrange, which I was not mentioning the health insurance part.
Mhm.
But after this is my last rotation, and this is the rotation which required me to have health insurance. All previous programs didn't require me to have health insurance.
It's Massachusetts,
Yeah. So
because I am in Massachusetts, so I know that.
so whenever someone asks me which things I should have before coming to the US, so I preferably mention health insurance, one of the biggest thing you should have in your hand before coming to the US. and it
Thank
is
you.
not an and it is not difficult at all to get that. Most
Thank
of the
you.
people
Yeah, go ahead. Go ahead. No rush.
Most of the fellows ask about thing how you can get health insurance. It is very difficult to get health insurance. We have to pay a lot of money. We have to do that. We have to do that. But when I show them how you can buy, it is not that expensive, and your health is more important than the money. If you can come here, you can arrange some extra budget to have an health insurance. So they think about it and they said yes, we can buy that. So this is what I want to say. Thank you so much.
Thank you. Thank you, Manan. That was really very, very helpful. And good luck for everything. And be safe and keep doing well. Really, really, it was very helpful. I know you work until late, and but this is very helpful. The last question to you would be that you feel comfortable over here asking your supervisor that if you don't feel well, that you need to leave or you need to take care of yourself.
To be honest, I must say that I am lucky enough to have very, very good preceptors. My all mentors are very good, and I am in my first week. I was doing rotation with US IMGs who have grown here or who have grown then, but this is my first rotation I am doing with an Englishman or American doctor. So I was first reluctant to talk to him, like how we should manage, how, like, I was not want to be personal with him, to be honest, in my first week. But he was so good. He himself talked to me different things like where are you staying, how is going everything, so and he helps me a lot. So then I shared some things like I am living there, and apart from that, I've made connections here through my research projects with different Indian people and different. So those people help me a lot. So I have text them that I live here. If I have any emergency or if I so you can contact. These are my parents' contact number. These are my emergency contact list. In case God forbid, if anything happened, you can contact them, you can tell them. So these things matter a lot. So before coming that, one must have contact here. I
Sure.
don't have any contact here. I when I came here, I made contact just for the safety. I
Yeah,
before,
Abdul, and this is was very, very helpful. I think this will be helping a lot of students. What you have said, what you have suggested, and we really appreciate that. You are here and you are sharing your thoughts about it. Our last but not the least, Faraz Siddiqui. He's an MPH and he's a fourth-year medical student at Galway University School of Medicine, Ireland. He will share his journey and preparedness going abroad from USA. So now there's a twist. This is the kid who is born and raised over here, and how much he was prepared. It is not just because of the parent, that how this society trained them, that when they go from here abroad, how much prepared they are. This is just for the comparison here. And he's on call, so he sent us his recorded message, which I'm gonna play. And so this is for Faraz Siddiqui, and this is the message from him. Good evening and assalamu alaikum, everyone. My name is Faraz Siddiqui, and I'm a fourth-year medical student at the University of Galway. First and foremost, I would like to thank Dr. Qutab for asking me to participate in this webinar. Unfortunately, I could not be here live today as I am stuck in a very busy rotation in a completely different time zone. So, when I was preparing to move to Ireland for medical school, one of my main priorities was health and safety, not just in a physical sense, but also in terms of emotional well-being and making sure that I had the right supports in place. Before leaving for Ireland, I made sure to have all my routine checkups done back home. So that would be my eye care and my dental care. And then I made sure to bring an adequate supply of my regular medications, copies of my prescriptions, and other key health documents. Once I arrived in Ireland, I headed to my university and found the Student Health Services Center, as well as the counseling and well-being support centers. The staff here was very friendly, and they made sure to direct me to the proper health and mental health resources that were available on campus and in the city that I'm at. And having these resources clearly laid out for me made the transition a lot smoother and eliminated much of the stress that I had. Now, growing up in the United States, I was taught that health and safety are shared responsibilities and that self-safety starts with awareness. In medicine, that translates into things like following infection control practices, wearing PPE properly, and being honest about your fatigue and stress levels, and speaking up if you ever felt uncertain in a clinical setting. I've also learned that personal health isn't just about avoiding illness, it's about maintaining balance, protecting your mental health, and knowing your own limits so that you can take care of others effectively. When it comes to emergency situations, I made sure to understand how the system works here in Ireland. Given that it's pretty different from back home in America, I had to know what numbers to call. For example, if I needed an ambulance, I needed to know that particular number. I needed to know where the nearest hospital is and who are the important contacts at the university if something serious ever happened. But beyond logistics, I think it's also about knowing how to advocate for yourself, whether that's reporting a concern, seeking medical attention when you need it, or asking for support when you're struggling.
And over time, I've really built a strong support network that includes my classmates, clinical mentors, friends here in Ireland, and friends and family back home. And knowing I have these people that I can reach out to, both professionally and personally, gives me a great sense of security. And I think that's what health and safety ultimately come down to. Being prepared, staying self-aware, and surrounding yourself with the right people and systems so that you can thrive in a new and unfamiliar environment. Thank you.
Yeah, good.
So this was for us, and this is what I think, that's what we have to focus, that it is the society that which trains you from your school, from your home, from your workplaces, that this is how you should be prepared. So I think that was very helpful, and we are very, thankful to Faraz that he participated and he put his point of view there. In the end, there will be a poll sent to the audience with 2 questions. And those questions are, what do you think students coming from Pakistan were well prepared before coming to USA in regards to their health safety? Yes and no. And then the second question, what do you think student going abroad from USA was prepared enough before leaving to Ireland? Yes or no. So those were sent there through an e-blast, through an email to all the APPNA members. So we will have a poll. And our next webinar will be on November 22nd, 11 a.m. Eastern, and details will be shared soon. So I think I will reach out to all our speakers that if they want to say something quick about closing of this webinar, that what their thoughts about this whole webinar, and is there anything that they will suggest. So we can go to
I'll just say one thing. I think there's no concept of insurance in Pakistan. There's no concept of medical insurance in Pakistan. You only go to the physician when you're sick. So as much as we feel they are, it's not important to them. It's a foreign concept. So I think education is the best way to educate these people because they are not prepared, because they can be prepared because they're not aware of these things. That's the only thing I'm going to say.
Thank you. Thank you, Dr. Heather. And Dr. Kidwai or Dr. Maksud, do you want to say something before we close this webinar?
I think all the respected panelists have thrown so much light, and I don't want to add anything because they are, they everything they have been said. Thank you.
It's there, that whatever need to be addressed is there.
It's there.
I think in the closing, this is what I think, what I want to say is that this is a deep-rooted issue in our society about ignorance in regards to our health. There is no quick fix, about it. And we need to be patient about it, need to put it together as like, when there's a jigsaw puzzle, you put pieces together and you do the brainstorming and you keep on going back and asking people, asking yourself that how we can come up with a solid plan that will help these students, to get the best help they can get about their health. So no student will lose his or her life, because of the no health insurance. It is a very important, there is a very important aspect into this, that we are putting stress on the academic performance, but not on the complete physical, emotional, and social health, you know, and supporting student for these issues is very, very important. And we need to address the health very holistically. That's what I'm seeing, that we are not taking it like, this is so important that once you are healthy, you can be a very, healthier part of the society, and it goes into generations, the healthy people. But I'm not seeing it. These are very vulnerable, high academically high achievers, but who are not paying attention to their health. So that's something we need to bring that awareness. In medicine, there is a saying, I was reading this, that the chapter you are reading today is going to save someone's life tomorrow. So what we are doing right now in this webinar Dr. Kidwai, Dr. Heather, Dr. Maksood, Dr. Abdul Manan, Dr. Sara, Amna, Faraz, me there, what we are trying to do, that at saving lives, like, we are taking this step forward. And I think Dr. Maksood's concern was very well put together, like, that if we see the participant, they are not much enough. And there was enough of the, we put it on the social media, on the Facebook, on the X, on eBlast and everything. And everyone was very well aware of. But the thing is that you cannot change the mindset so quick. So don't be disappointed that if there are not much participant there or not much attendees there, because this is a process and we just started it. So as Dr. Heather said, saving one life is saving humanity. Dr. Kidwai, that's what he was doing there. I am doing over here that I'm bringing this message, guys. This is serious. This is serious. So I don't think so. We should be discouraged. We should be feeling that, why. I think it's a process, and this is the most hardest one. Like, this is not easy. This is not gonna be easy. You will be discouraged. You will be, what's going on with them, why they want to do it. We know that this is a different system there. You guys are, you guys know that. It's not gonna be easy. But you are there, you know.
I think this excellent today what we did, and it's a matter of building a team. This is not
Yeah,
1% job. We build a team, and that team really can bring a change in our society, and that's where it's going to start from today. And hopefully, as we do more webinar, we need to have some student representative to spread these information to the groups and have them to be responsible and have them to commit some time for this. That's very important, because if we have people on the ground in all the university and colleges, that will bring a change. So
yes,
working closely with the administration of the college, universities, and having the student organizations, um, getting them on board, collaborating and communicating with them,
sure,
and that will make a change. This is what kind of effort we need, and
exactly.
also the government should be engaged in this process.
Yes, yes, big time. And you know what? That's the thing that I am so, so, so thankful and so proud of you all, that we are all here because we sensed it that this is so important. Like, I was there calling, talking to them, and I see their pain, not like physically being there, but whatever I was getting from them. Dr. Kidwai, he was there, he saw it. So that's why he's here today, that he said, yes, I want to be a part of this voice. I want to part of this webinar because I want to convey them that this is how serious it is. Dr. Heather, he sees students all the time. He said that, yes, I need to be there. He felt that responsibility, and he's there. He's a busy gastroenterologist. I know that, and he's here for last 1.5 hours. Dr. Maksood is here. He's very busy. Manan, he's doing his observership. Dr. Sara was on call. Amna had to go somewhere. My son was a little bit his health is. So I am here because this is how we need people. They need to feel responsible. They need to be there. They need to be able to be supportive. So I think that's the message to all our young IMGs, that yes, we are here for you. Be serious, be proactive, be take an ownership. So they are smart people, they are doctors. So I think this is a message from all our this group of people, that hey, you know what, I think we made a difference today.
I just want to add one small thing. I think just listening to Maksud, I think we need to reach out to these universities and maybe invite them to these webinars so they can have firsthand knowledge, or they can tell us what are the hurdles and what they need in education. Maybe if there's a student unions and they can be part of this, I think I like his idea of that reaching out to the institute and maybe inviting government too. I don't know whether they will come or not, but at least we can start a next level integration of this to a different reaching out to the people who can really make, who can be on the ground where the students are.
Today's webinar was that it is taking a step. It's not a leap, but it's taking a step. So that's why I put all those people together who I felt that, showing to the IMGs or showing to all the other people there that there are people who wants to talk about it, and they are very relevant people. Like, if I was there or if Dr. Kidwai was there, liaison committee members were there, that I am the chair of the liaison. So they were aware of this and they wanted to be a part of it. When I talk to you, and when I talk to Manan or Sarah, what I'm trying to say that this webinar is just a beginning, it is just a beginning, and there is no big promises, but it is a beginning. And I'm so, so, so thankful to all of you guys that when I reach out to you guys and you says, yes, she's making some sense there, and then we need to be a part of it. So it is not easy to be the first one. It is never, ever easy, and you guys did it because you have a heart there. You know that this is serious. So yes, we will be trying to reach out to the institute. We will. So this is a recording. So what this will be go on to the YouTube, and I will send you the link. You guys can put it on your YouTubes. We're gonna send it to the institute. You guys are happy to share it with your institutes. So if there are less participants or there is zero, but still we can share this whole webinar to all our institute, and whoever wants to see it, and it will be there.
Inshallah.
Inshallah. Thank you. बहुत बहुत शुक्रिया आप लोगों का. और let's hope for the best.
Inshallah.
Yeah, this is just a step, we took that today.
Thank you. Assalamu alaikum.
All right. Thank you very much,
Thank you.
everybody.
Allah Hafiz.
Thank you. Allah Hafiz.
Allah Hafiz.